Welcome to my podcast. Today I'm going to talk about two microbes which encountered in the surgical ward and in patient mostly who's elderly and vulnerable. So basically I'm going to talk what's the common things between Clostridium difficile and MRSA, which is methicillin resistant Staph aureus. So basically you will present with a case who has been admitted to the hospital, say for instance 5 to 7 days, and possibly the patient had pneumonia for which he has been admitted and has received antibiotic. However, the patient within a few days' time developed diarrhea before getting discharged. And in further investigation, the diagnosis has been made for the presence of Clostridium difficile associated with diarrhea. So in such condition, how can you tackle this case, and how can you differentiate between this and MRSA? So basically, after you see the patient and introduce yourself and double check the patient name and date of birth and address, you'll ask what brought you to the hospital. So the patient might say, well, doctor, I had cough, I had shortness of breath, I had fever. I've been unwell for the last few days. I've been diagnosed with pneumonia, and then I have received some antibiotic which made me feel better. However, I developed diarrhea for the last few days. So in this condition, you need to inquire about how frequent the patient passed stool and what's the consistency. Is it watery? Is it semi-solid? Is it solid? Is there any smell associated? Is there any mucus? Is there any blood, for instance? So you need to inquire about all that. So basically, when you need to explain to the patient, you say, well, basically, in our gut, we have bugs. Some are good, some are bad, but whenever, so in certain condition, when we give antibiotics, so it might kill the good one, and this will lead to overgrowth of other bacteria. This is called Clostridium difficile associated diarrhea, or it could lead due to causing a membrane, which is called pseudomembranous colitis. So you just need to explain to the patient in simple terms that there is good bugs, which it is the normal flora, which help our gut for digestion of the food and provide the required media for the bowel. However, in certain situations, like taking antibiotic, or like for instance, we know that certain antibiotics are associated with Clostridium difficile, like for instance, BB inhibitor, clindamycin, vancomycin, quinolone, cephalosporin. All of that could lead to such situation. So possibly also you need to, once you put this as a differentiation, you need to explore other causes. Could be like food poisoning. Maybe the patient had ate certain food, or maybe his relative brought him something from outside. So you need to inquire also if this one happened immediately, for instance, after the intake of the food, or if there is any blood associated, or if there is any fever, or if there is any vomiting associated as well. And then you need to tell the patient that there are certain measures should be taken into consideration. For instance, the patient should be put in a separate room in order to avoid cross-infection between patient or person to person. Also, you need to adopt the way of washing hands regularly. And also you need to explain to the patient, because sometimes they might think that they were given the wrong medication. So you need to say, I can see your main concern, but certain antibiotic might cause this. There is nothing wrong with the antibiotic or as a side effect to this. Also, you need to explain that bugs sometimes can pass from one person to another, and that's why we need to keep you in a separate room and wash hands regularly and frequently. And we need to do certain other investigations just to double check if there is something, wrong. in the bowel if there is a need, which is a camera tube from down below, which is either endoscopy or colonoscopy. And then you need to tell the patient that this antibiotic should be stopped, and we should, of course, check if the patient is dehydrated, because we need to compensate for the fluid lost already through the diarrhea. And also we need to explain to the patient that we might give another antibiotic to counter this problem. Say, for instance, we might give vancomycin in those kind of cases, or flagyl, which is metronidazole, for a week or 10 days. So based on this situation, you have to put in mind that this case should be urgently treated, because complication can be imminent, like, for instance, bowel perforation. And apart from all that, you need to, of course, for instance, if the patient used anything, should be cleaned immediately, and should adopt, as I said, hand wash regularly with soap and water and sanitizer. So all of that should be kept into consideration. And also tell the patient that you shouldn't share any towel or any clothing at all, and any contaminated cloth or sheet should be kept separate, because it will be treated differently at high temperature. And also you need to give a certain guideline if there is any relative that they're going to visit him. So, and especially if there is children, they shouldn't be allowed to come nearby any patient have or harbor this kind of bacteria. And also, if there is anything that doesn't seem right for the patient, you need to notify the doctor in charge. So that's basically in relation to those kind of cases, if it happened, because most of those cases usually happen in the hospital, so it's acquired condition. And it's basically, as I say, due to antibiotic that being given for a certain condition. For MRSA, it's usually the patient will harbor this bacteria usually as a carrier in their skin or in their nose. So antibiotic is not indicated in those kind of cases unless they have symptom, because most of those cases they are symptomless. And usually in such condition, it's only mupirocin, which is topical antibiotic, given as a cream, whereby to apply on the nostril or in the area which showed that the patient carried this kind of bacteria, because it's called in a slang language as a superbug, because it's quite a strong one. So by that, I hope that I covered the main points about MRSA and Clostridia deficient. Basically, as I say, it's just they have common points in between. We just need to explain to the patient if they have any main concern, because usually as a patient they might think in those kind of cases there is something wrong with their medication, which could cause them this problem. And in both cases, of course, if, for instance, in the MRSA, if the patient is with symptom, so he need to be as well treated as infectious case, and should be put in a separate room, and should be treated as Clostridia deficit with, added to the decolonization and the antibacterial body wash that should be advised or recommended to the patient. Apart from that, it's more or less they have common things, like, for instance, don't share clothing, don't share towels, use fresh one. Should be, if after they receive this topical cream, they can send for a swab again for culture, just to double check that they're not harboring or carrying the bacteria anymore. Usually the swab will be taken from the nostril, armpit, groin, any body fold. Also, if there is any damage in the skin, certain condition also from the throat, and the result will be available within few days time. So I hope that I covered MRSA and cholesterol deficient briefly, with the main important point to consider in tackling such cases. Thank you.